Welcome to this episode of Grassroots Advocacy. Thank you for joining us. If you haven't had an opportunity, please go back and look at the previous episodes. It will help you to have a very broad perspective of the topic of grassroots advocacy and your role as an advocate. In the previous episode, we had the opportunity to look at residents' rights. And in this episode, what I wanted us to do was to build on that notion of residents' rights and to really hone in on the idea of creating a win-win situation. Now, you might say, or you might be asking, why is it necessary to create a win-win situation? Well, there are a variety of reasons for doing that. One of the reasons that you might want to try to create a win-win is so that everybody feels like they're getting something good out of the situation. Another reason that you might want to work to create a win-win situation is because it gives you an opportunity to think through not only the barriers, but the various solutions. So it gives you the opportunity to problem solve in a really fun way. Another reason that you might want to think about trying to create a win-win situation is because it gives you the opportunity to gather additional information that you may not necessarily already have. And so in the previous episode, one example we gave was a nursing assistant who went to a resident and asked the resident if they would take a shower, and then the resident refused. So the nursing assistant went back and told their charge nurse that the resident refused, and the charge nurse says, "I don't care. He's got to get his shower today." That creates a challenge and a dilemma for you as an advocate and as a caregiver. And so, as an advocate and as a caregiver, how you approach that situation will set you up for success or might set you up for failure. For example, some leaders, when you say, well, Mr. So-and-so said he didn't want to take a shower and it is his right to refuse care, some leaders might see that as you questioning their authority. And so that's not a situation you would want to create, because then that person will be less likely to listen to you and engage with you. So it's really about thinking about, how do I create win-wins? So what I'd like to do now is go over 6 steps. And if you follow these steps, or if you follow this process, you're likely to create win-win scenarios. So step number 1 is think about preserving relationships. My grandmama, may God rest her soul, she used to always say that you get more flies with honey than you do with vinegar. And that is true, both figuratively and literally. And so what you want to think about is the various relationships that you encounter in your day-to-day service of our nation's frail, elder, and disabled citizens. So you have the resident, patient, neighbor, depending upon how you refer to the people in your community that you care for. You have the licensed and registered staff that you work with and assist on a daily basis. You have the other departments, therapies, activities, social services, all of these different departments. So think about all of those relationships and how to maintain all of those relationships in a positive way. The next item, item number 2, is to gather all of the necessary information. So in the scenario where you're being asked to give Mr. Brown a shower and he's refusing the shower, one of the things that might be good to do is to say to Mr. Brown, I understand that you don't want to take a shower now. Is there a better time Is there a time you would like to take a shower? If not right now, when? Or you might approach it from a standpoint of saying, Mr. Brown, would you tell me about your bathing habits when you were at home? And Mr. Brown might say, I don't usually bathe, but every third day, kind of like Jesus, every third day. Or he might say, you know what, I don't shower at all. I don't like showers. I'm afraid I'm going to fall. I prefer to take a bath. So you want to talk to Mr. Brown and really understand where he's coming from when it comes to bathing or showering or whatever the case may be. You also want to visit with the licensed or registered person and say, Nurse Emily, I understand that you really want him to have a shower. Can you help me understand why it's really important for him to have a shower right now? And she might say, well, I've noticed on the nursing notes that he hasn't bathed in quite a while. I've also noticed that on the last skin assessment, he had a reddened area, and we don't want his skin to be compromised or to break down, and hygiene is an important part of that process. So you want to gather all of your information. The next thing that you want to do is you want to create a safe environment. And so when we talk about creating a safe environment, what we're doing is we're talking about, in Mr. Brown's case, presenting him with options and acknowledging and respecting his preferences and doing it in such a way that gives him a sense or measure of control. With the licensed and registered staff, what we want to do is we want to present our thoughts and our perspectives from a standpoint that's not about challenging authority or responsibility. It's about creating alternatives. So you might say, Nurse Emily, I really appreciate, thank you for sharing that information with me. I wasn't aware that he hadn't showered recently and that he had a reddened area. Thank you for sharing that with me. Given that he's been resistant to showering, how would you feel if I offered him a bed bath? How would you feel if we focused hygiene on the area where the redness is appearing? In this way, you're not really saying, I'm not going to do it, or you're not pretending, or you're not acting as if though you don't want to do it. You're thinking about it and presenting it in terms of options. And that's something that we, as part of a team, a healthcare team, should be doing for one another, is thinking about those creative options. The next thing that you want to do in terms of this 6-step process is really to think about clearly defining and agreeing on what the core issue is. So in the example that we've been using throughout this episode, the core issue is that Mr. Brown needs to bathe in order to maintain health, to maintain hygiene and healthy skin integrity. And so we want to clearly define what the desired outcome is. We want to, and in Mr. Brown's case, it's very clear. We want him to have good hygiene, which allows him to maintain the best skin integrity that he can, given all of the other variables that are in play. And once we then clearly define what the issue is, then we want to move on to looking at all of the various possibilities, brainstorming the possibilities. So in Mr. Brown's case, we might offer him a bath instead of a shower. We might offer him a bed bath as opposed to a shower. We might have a conversation with him and help him understand that he is at risk for tissue compromise, partly because of his hygiene. So you want to think through what are all of the various options that are at our disposal that we can use. Because once you have listed all of these possible options, then you can pick the option that best meets the needs of everybody involved. So the nurse's need is to make sure that Mr. Brown has good skin integrity, or pardon me, has good hygiene. I misspoke. Mr. Brown's thing is to be able to have control about how he gets his hygiene. So once you've gone through and you've brainstormed, the final step is to negotiate the solution. So you go back to Nurse Emily and you say, Nurse Emily, so we had talked about a bed bath. We had talked about a bath as opposed to a shower. We had talked about offering Mr. Brown some flexibility. And what Mr. Brown decided was that he would be glad to take a whirlpool this afternoon between lunch and dinner. Does that meet your needs? It does? Great. And because Mr. Brown had choices and because his preferences were honored, he's happy. So we can use the same process to create win-wins without regard to what the scenario might be. Let's say, for the sake of discussion, that you have a peer, a fellow nursing assistant, who wants to take a break at a particular time. That could possibly create problems or challenges or issues. But if you work with them and you work through this process because you want to keep them as your friend, as your ally, as your colleague, your teammate, then you would look at, what are we going to do to preserve our relationship? What are we going to do? Let's gather information. Let's have create a safe environment so folks feel comfortable. We're going to look at defining the issue. So the issue is, we're staff challenged and my coworker wants to take a break right now and we're already shorthanded. Then you want to look at what are our possible solutions. Well, right now, CNA Nancy, we are in the process of getting folks down to the dining room. So right now is not a great time to take a break. Would you be interested in taking a break after we get done getting people to the dining room? Or maybe would you be interested in taking a break about 1 o'clock? So you want to look at those, you want to brainstorm your options, and then you want to negotiate those solutions in a way that makes sense for everybody. By the way, these steps, this process, it's not a process that I created. It was a process created by another thinker. And down at the bottom of the slide, you can see where to go and read more about this process. As an advocate, it's really important for you to think about ways to create those win-win scenarios or win-win situations. And when you do that, you will be more effective as an advocate because you will have created a change in a positive way. You will create an outcome that meets the most group of people's needs. To wrap up our segment today, I'd like to share with you a quote from Orrin Woodard. The true test of character is to live win-win, even when promoted to positions where win-lose is possible. I encourage you as frontline caregivers to seek to create win-win situations wherever you can. I look forward to being with you for the next episode. Until then, be well.